Okay. James Raven. Wow. If I turn and look at his picture, I'll start to cry. He had this crooked smile, and those eyes were always dancing and always glistening. And he always saw the good in people. He was generous, loving.
Val's a very strong woman, right? It takes her a lot to be broken. James was a strong man as well, very strong. He knew that the system was broken. He wasn't probably getting the medical attention that he deserved as a human being. And I'm not just saying Indigenous as well, just as a human being, which is sad, you know? It breaks my heart to constantly hear these stories over and over again.
I know her and James were so close, and the day that she had told the news of his passing, it was more heartbreaking because of all the struggles they both went to trying to get him help.
He was in the 60 scoop. His mom was 13 or 12 when she gave birth. They scooped the baby right away. Mom tried following, trying to get him back. They moved to another city in Alberta. She followed. Then they moved way back east and she couldn't follow anymore. I don't know her journey as much. James has tried piecing it together, but she ended up in the downtown east side. His adoptive family was very abusive, physically, sexually, beatings, and he was always told he was an experiment so that they would know how to raise their own children when they had them. The adopted dad would drive him down to the downtown east side and just go, "You're going to end up down here. This is where you're going to go."
I believe he would have had more of a fighting chance if the healthcare system stepped up and did what they were supposed to do for him. And the healthcare system failed him 100% by neglecting him, by ignoring him, and by not treating him with the needs that he needed at the time.
James got some sores on his legs that needed to be treated, and they just kept getting worse and worse, and he would go to emergency, and a lot of times he was treated very badly. And we have the STOP team here in Vancouver, which are an amazing group of people that work tirelessly down here, and they've looked after him also, and they popped up to see him. While they're talking with him, somebody, staff, nurse, walked into his room with his morphine, because that's what his choice was to get off of the methadose. Like, he didn't want any more of that, so they were giving him morphine, and that was working for him. After trying so many other things, they got something that worked. And she walked in and she says, "Has the pills?" And she goes, "Oh, I guess this is for your pleasure, isn't it?" And he just hung his head. He didn't know what to say, not realizing that two nurses were standing right there who put in complaints of how Indigenous people were being treated, and also the label of downtown east side. And there's just so many of them that they just broke his spirit, they broke his heart. And a lot of times when he was living on the streets and he had these open sores, you know, they'd go to Dr. Peter's Center and he'd want to go out and be in the trees. So he would go out, lose track of time, and one of the nurses that works there would give his bed away. Because you're not coming back in time, so we'll give it to someone that needs it. And they put him back out on the streets. And those sores to the day he left this world is what I believe actually killed him, was the infection, because they never got rid of it.
I was up in the ward with Val at the time, and I just walked in the room and just saw that James was very unhappy, right? I knew that he was being stigmatized and emotionally, mentally, that he wasn't happy here, that people were not treating him with the respect that he should have been treated with. I'm going to go back to our Indigenous people. It's a lot of people that don't want to go into that hospital because of the bricks that are on the outside. That reminds them of residential school. And so they have a hard time getting through the door. And then once they get through the emergency, they're basically labeled. And the first three questions that because I've talked to a lot of people that don't go there anymore. First question is, hi so-and-so. What have you been drinking, or what drugs have you been doing?
I've experienced multiple times where people have treated me wrong because I'm Indigenous. And as a light-skinned person, often I go in and I'm treated one way until I show my status card. Then I feel like I'm just pushed aside, even in the waiting room. The things that I'm asking, like, for help for, kind of get dismissed. And it's just weird that it's literally when I show my health, like my status card, is when people's perspective of me changes. At St. Paul's Hospital, I remember going there when I was about 21 because I got drugged and I was scared. And I didn't know what was happening, and I kept coming in and out of consciousness, and I didn't feel okay. So I went to the hospital, and the only thing that they gave me was blankets and a sandwich and told me to go on my way, and they didn't even test me. They just tested me. They just gave me STI testing. They didn't even rape kit test me. They didn't test my blood for drugs. They just tested to see if I had HIV, syphilis, chlamydia, and gonorrhea. And that's not what I asked for. And then they sent me on my way, and I was still very disorientated when I left, and it was winter time. I think that's probably the worst that I've had at St. Paul's, and I just haven't gone back.
I pushed the call button and have a nurse come in. Well, this nurse basically came in, and she said, "Can't you tell we're busy?" I said, "I never ring this buzzer." I said, "I need my wound changed, right? Because it's seeping." "Well, we're really busy." And so I told her off. I said, "You know what? You can leave the room and don't come back." She never did come back. So they had nurses sort of say, "Yeah, we've had some problems with this nurse and we'll make sure she doesn't come back."
This was very sad. An elderly lady, her niece is one of our clients. Since she came in, she goes, "I have my aunt that needs to come and see you. Is that okay?" I said, "Of course." I said, "Yeah, why are you asking?" And she goes, "Well, she lives on the island." And she said, "I went to the clinic in our area and they sent her home with antibiotics, saying that her leg was just irritated and a little bit infected." I said, "Okay." And she said, "I went to the emergency room 3 times in Nanaimo, and they sent me home with more antibiotics, saying that my leg was just severely infected, that the antibiotics work." And she had said to them, "I've already been on antibiotics 2 times, and it's not getting better." They said, "Well, these ones are stronger than the ones of the last time, so you should be fine. So you could go home now." So she went home, and she couldn't even eat. She hadn't eaten. She hadn't drank anything because her leg was that infected. So I said, "Oh my God, that's horrible, and I'm sorry that happened to you." So I said I was gonna look for a clinic to call Kilele because we've got a couple doctors there that we're connected with. And she goes, do you mind if we show you her leg first? Like, not at all. And she literally had to cut her pant leg to open it up. It was almost as black as my pants. And the blisters were pretty bad. So her niece brought her to Mount St. Joseph's. And I really like them because they're the only hospital that does not stigmatize, that doesn't treat people with bad, like with judgment or anything. And they're very fast and very thorough. Like, I really like them. And her niece called me about 4 hours later. She goes, as soon as we got here, they admitted her and they put her on a IV antibiotic. And they've done blood work, they've done scans, CT scans, they've done every test they could think of. I said, that's great. I'm so glad that she's getting hydrated and her IV in proper care. And her niece called me, I think probably around midnight. And she goes, she's sleeping now. They've given her a sedative so she could sleep. And I said, so what was the outcome? And they said, with all the scans and stuff they did, she had 4-stage liver cirrhosis. So she was close. If the doctors and clinics on the island would have just done some blood work or a scan or something for her, they would have caught it at the 1st or 2nd stage, and it wouldn't have gotten this bad.
I've always been addicted to something all my life. I think because my dad worked 2 jobs and my mom did not know how to show love. I craved and was always craving love and acceptance and acknowledgement. And I was introduced by the Indigenous support worker at one of the schools that I worked. I was introduced to crack cocaine. They called themselves weekend warriors because they only partied on the weekends. It overtook me. I could do it on weekends for maybe a couple years, but it was that craving and the numbness that it gave me. And I ended up in the downtown east side. The addiction overtook me. And it was a way to numb all the hurt, I think, that I'd suffered right from childhood all the way through. And my youngest 2 sons went to live with my mom and dad. So for 10 years, I was lost on the streets. I was underhoused. I lived in doorways and parks. I dumpster dived for food, for anything that you could sell at a store. To keep myself numb from all the different things, that's why I had so many addictions. From the more that I stayed blurred, I guess is a good word, I wouldn't have to think about the hurt and the anger I had for myself with the kids. And then I got introduced to crystal meth, and that became my drug of choice.
St. Paul's is overworked. Like, I honestly believe that they're desensitized because they're overworked and could be understaffed, I don't know. For some reason, they get all the homeless, they get all the addicts. I'm not sure if that's just a condition, or I'm not sure what it is, but it has desensitized the staff. To me, it desensitized them to not care, to treat every person that goes in there that they're an addict or a drug addict or an alcoholic. And even if they are, that's not for them to judge. That's not for them to be there and shame them or not treat them for what their medical need is. So I have a few clients that had called me from St. Paul's. This lady, she's a heroin addict, and she's had some severe trauma in her life. She has been trying to get a lot of help for her addiction, and she has gone to, they have an addiction unit in St. Paul's. So to me, I would think, okay, our hospital, all the staff are very aware that this addiction unit is in St. Paul's. It's an overdose prevention unit. So of course they're going to have people with addiction coming there for either withdrawals or being sick or overdose. So it's to be expected. But this young lady, she called me and she said, they are not letting me into the emergency room. And I said, okay, just hang in there. I'll be there as soon as I can. So I got to the hospital, I park and I come around to emergency room. And she's outside going through severe withdrawals. And the security guard standing there with his arms crossed. I'm like, what is going on here? He is, well, she can't come in. I'm like, why can't she come in? This is an emergency room. She is seeking help from an emergency room. She was acting up. She was flailing. She was being aggressive. I said, well, she's going through withdrawal, so she's not going to realize what she's doing. I said, how long have you been working here for? And he said that he had been working there for quite a while. I said, well, then you should know the symptoms of withdrawals. You should understand that the people that are going through withdrawals are going to be aggressive because they have no control over their body functions or their emotions because they're through their withdrawals in the moment. Yes, well, I don't know that. I'm not a doctor. I'm like, well, that's why she's here to see a doctor, and you're preventing her from doing that. And long story short, it took me about half an hour to get her admitted into the hospital so she could get her withdrawals at ease. But that's like one of many. Some of them decide that they don't want to be bothered with being treated with stigma or treated badly just because they're trying to self-medicate through the trauma that they've been endured on as a child or as a young adult.
And the day that I let the trauma go, I was seeing a counselor, and she said one thing, or there was a smell or something, and it just bubbled up. It just bubbled up. And I said, give me a black crayon. And that crayon was no more when I was done. And she goes, what are you doing? And I said, just let me go. And I took that and I said, I've just put all my trauma on paper. I've forgiven my uncle. I've forgiven my mom for knowing. I'm forgiving everyone because I wouldn't be who I am today if I didn't experience all this, as tough as it was. And then I took that paper and I burnt it, and I collected up all the ashes and I took it to the ocean and I asked, take it away. So from fire to water, which are my signs. And as soon as I let that go, my addictions were gone. There was nothing. It was like this black crayon of emotion was from my spirit right onto that paper. And I think that's a journey that we have to, that may help others, is that, is that forgiveness part and not carrying it. And I don't have the nightmares anymore. I don't have the bad dreams anymore. It was a beautiful, amazing, I can't describe it. It was like, I don't know, a bowl of burning sage went in me and just cleansed me out. That's the only way I can describe it. It was just like this healing energy came in and the black came out and the healing energy stayed. So along this journey, it was like trying to turn my life around, and I realized that I'd lost 10 years of my life. And I wanted, I guess, in my head to make up for it. So I started like going out and just like, where am I going? And I was really advocating for housing at the time. The Homeless Coalition was there. the city giving us a rough time, all their double talk. And that's when I needed to turn around, and I heard that drum on corner of Main and Hastings. And I heard the drum, and I just ran to it, and they said, "Welcome home, Valerie." And it just brought me home. And that's how I met James, because I was actually working down here. And he actually went to a positive gathering. And I had to ground myself as I was the keynote speaker that night. And I went out, just out onto the patio of the hotel, and just wanted to be under the trees. And he followed me. And he didn't ever stop following me. We were each other's soulmates. It was just deep, and he quickly became mushroomed to the grandchildren, and they just loved him. And in fact, one of the grandchildren has a bond still with him. He would know when he was sick. Gotta go see James, gotta go see him now. Would know when he was sick. So James was battling a lot of issues. He had Hep C, he had HIV, which he was on meds for HIV, but not for the Hep C. And his liver was in failure, and he was really sick. And only one doctor that they found said that they would do a liver transplant if someone came up. No other doctors would, because of the HIV. And a wonderful doctor at St. Paul's, Dr. Mark Hall, was his specialist, and he phoned all the pharmaceutical companies, like, what's coming out for Hep C, as the only one out was interferon at that time, and they knew that would kill him. And they said, well, there's something new and upcoming. It's expensive right now because it's still in trials, and it's not out on pharmacies yet. And Dr. Hull and his office assistant or office manager really worked hard with them and said, you know, this man is going to die if we don't do something. And they gifted us the medication for him, and which I'm so grateful. And wow, what a turnaround in 2 weeks. And even though he was still on methadose and methadone, as it changed, he was living a life of love, and he also worked at Healing Our Spirit. That's before I met him, and he used to travel and educate, especially in places, you know, on reserve where, you know, 20 years ago they still weren't allowing us in there. So he was positive for a long time. And we exchanged beautiful silver rings under a cedar tree and committed ourselves to each other spiritually and forever. He also volunteered at the SPCA with me. He loved animals. He was such a wonderful spiritual man.
I think this project is important because it amplifies the voices of people who have been harmed, and it brings light to a huge problem that's happening all across Canada that most people want to look away from and don't want to believe is happening. A lot of the times when I tell my multiple encounters with bad health care, most people are like, oh, that didn't happen to me. And I'm like, well, you're not Indigenous and you're not a woman, because I feel like as an Indigenous woman living in Canada, I am unsafe in the healthcare system. I am unsafe with our law system. And anytime I bring that up, people just get uncomfortable. And I think this project's important because people need to be uncomfortable.
This is my goal. I want reconciliation with Indigenous people. I want to seek reconciliation with them and their healthcare system. A lot of us stop at fighting for our rights where the doctor says no, or when the pharmacy says you need to pay for this because it's not covered. I am assuming a lot of that comes from residential school survivors of being conditioned to the authority figures. Like, okay, no, I have a right to say, I know that this is covered, and I know this, that you're not treating me with respect or kindness like you are the person that's coming in next. So these things are things that I do is to, one, help people that have trauma or anxiety in general from bad experiences in healthcare, to either go with them to a hospital or to a doctor to make sure that they get their health care that they need without attitude, without impatience, without inconsideration, and to make sure that they're treated with like anybody else that walks through those doors.
A lot of our frontline workers, our nurses and doctors, as I call it, they're textbook savvy. They've gone to school for years and years, and that's what they learn. They don't know what's on the streets. How many of them walked in the downtown east side and really seeing what people are doing, or ask questions why they're there, or why don't they want to come to the hospital?
The Creator, I think, gave me the gift of HIV so I could do this work. You know, in the beginning, I didn't see it as a gift because of being on pills and all the restrictions and everything that comes with it. But today, I know it was a gift, and I've been able to travel the world from Australia to South Africa to Amsterdam, down in the States, to actually stand up and speak for those that don't have a voice that can carry. They call me the word warrior because I'm on a journey to change the words that we use when we're supporting each other. But I really wanted to change how, when people are also doing research, that you're talking about a human being here. You know, I'm much more than that statistic that's up on that board, and I'm much more than that graph. I'm that voice behind it. I'm that person. I was called to St. Paul's for a newly diagnosed Indigenous woman. She was being diagnosed with HIV, and the nurses were almost bullying her into taking her HIV meds. First of all, she didn't believe she had HIV. She was not convinced that it was a real thing. They hadn't educated her on HIV. They were just telling her to take these pills. And as they're sort of having this heated conversation, I walked in and I introduced myself and I said, let's just put those pills away for him right now. And she looked at me and her eyes opened like, what? And I said, we don't have to take them right now. Well, the two nurses ran out and reported me because I'm telling someone not to take their meds. And I said, you know what, we have time. I said, my name's Valerie and I'm living with HIV. And I take my meds every day. And so if we take our meds, this is what's going to happen to us. And I just said, explain HIV, what it was, how it came into the body, which she still felt that she hadn't done that, so she couldn't have HIV. That's okay, well, you can. And we went to as much as she wanted to learn and we stopped. And then I said, you know, when we met again, I said, this is what happens when we don't take our medications. And I explained all the opportunist infections and, you know, how sick we would get and how it's a very painful death of dying this way. I let her make an informed choice. And my manager at the time said, Val, you have in your, you know, all the ones that you support, you have the highest rate of adherence. How are you doing this? I said, because I don't tell them what to do, because that's what an intervention is. It's top down, somebody of authority telling you what to do. 60 Scoop was an intervention. Residential school was an intervention. I mean, if we were told as a teenager you couldn't go out on a date that night, we would do it anyway. So I said, let's make positive actions, like instead of an intervention. Let's have positive, healthy actions if we need the word healthy in there. And that way we're working in a circle. We're all working together at the same level. And it's not me telling you what to do. You're making an informed choice.
I haven't filed complaints for any of the things that have happened to me except for one time. And the reason why I haven't is because most of the things that happened to me were when I was a child and I was unaware that you could file a complaint. because doctors and nurses are people of power, and I was just a teenager. I was just a kid. And when I was homeless, who was gonna believe me? I was a homeless Indigenous addict. Who were they gonna believe, me or a doctor who's been to school and has seniority and all this above me? And the only time I have complained is because I felt a sense of safety with the head doctor of the clinic. The reason why I felt a sense of safety with that one doctor is because I've been working with her for 6 years, and when I do see her, she actually asks me how I'm doing, and she actually takes the time to listen to me, and she often will tell me how proud of me she is because she's seen me from being newly sober to who I am today. And I can see how genuine and authentic she is when she asks me how my health is. And this happened in her clinic where a doctor mistreated me and misspoke to me. And I kind of ran away from the clinic for a little bit, and she called me. And that's when I broke down and told her, because I knew she would believe me. And I think that's the biggest part, is I knew she would believe me, and I knew she would take my word, and she let that nurse go. She took action. A way that I would tell other Indigenous people to respond to these acts of racism in healthcare would most likely be to not respond in anger, but to also know that there's power in numbers, and it's fine if you want to have someone come with you to those appointments to advocate for you, to witness, to make sure that things aren't being done properly. I find that when people go in pairs, less harm happens, and also to listen to your community of spaces that are unsafe, which I'm already aware that our community already does.
Use your voice, because there may be a day that you cannot use your voice, that you need an advocate with you to speak on your behalf.
I'm starting to see some change in the healthcare system in some spaces, which is good because it's a start. The BC Centre for Disease Control noticed that there is not a lot of Indigenous population accessing their services, so they got a huge project in 2019 with a bunch of Indigenous people, different ages, different genders from different nations, to talk about why they wouldn't go to their clinics. And we reviewed 3 different clinics and they implemented some change there. I think that's a good start to the bigger problem. I think it can start with training the healthcare professionals on how to be culturally safe and not just check it off a box that, like, oh, we did this like 20-minute training, so now we're woke. It needs to be more than that. But I think if we actually start training all healthcare professionals, then we could get a little bit more change.
What I know now from working with Indigenous Innovations, there was so much more that could have been done differently. And that's one of the reasons why I really like my job now, is the hospitals and clinics now have, like, the Indigenous culture now has backup, where people, if their voices are ignored, as James and Val's was, they got people like myself and people with authority that we are now connected to help resolve that and get them the health care that they shouldn't have to fight for.
A little bit of change is happening, but again, it's baby steps, right? It's not going to happen overnight.
100%, without hesitation, that James was treated with so much disrespect and just not given the care that he needed like anybody else. Again, it's like some of the other clients that I've had to go and literally battle for to get health care. And it's not because there's a drug addict that goes in that's withdrawal, but then there's an indigenous drug addict that goes in that gets treated 10 times worse because they're indigenous.
He was funny, he was giving, he was just, I miss him so much. And I know he looks after his grandchildren, so he's still that caring person that he was on this Mother Earth as he is in Star World. He's just, you know, he was so hurt by not finding his mom. She died here in the downtown east side. He came looking for her. He had so much love for her, even though he'd never met her. And found where she lived, but she was out. And he came back 2 days later, and she'd passed away the night before of a poisoning. He never forgave himself for that. And we had many ceremonies of letting go, but it was something, his love of family, that's all he wanted. He had his first Christmas tree here. So I think James Raven was just spiritual love. And we miss him. And the reason that I chose the word broken arrow for this project is a teaching that he had given me was healthcare broke him. Healthcare failed him. But a broken arrow also means peace and working together. And I think that's what he wants. I know that's what he wanted. Thank you for letting me share.